I'm going to hit start. All right. Good morning, everyone. Welcome to Pennie's community partner work group for September. Happy to have you, and thank you for being with us today. My name is Kelsey Cameron. I'm the Marcom manager here at Pennie. I'm standing in for Marie today to help moderate the work group. So we're going to start off with some housekeeping items. Before we get started, let's just cover some stuff. This call is being recorded and conducted via MS Teams Live. If you would like to refer to this material at a later time, you can do so by accessing them at agency.pennie.com and clicking on Workgroup. All attendees' lines are muted, and we have Pennie staff monitoring the chat for general questions and clarifications. All right, so let's now move over into the agenda. So today we have a couple important agenda items. We're going to be covering Pennie community updates, an unwinding update, touching a little bit on the 2024 Assister and Broker Recertification Training, discussing the 2024 planned shopping enhancements, and the upcoming system enhancements, as well as policy proposals and update. All right, so we can move forward. We're just going to touch a little bit here, starting now on what's coming up in the October community work group. So that date is on October 6th. We really encourage everyone to join because we're going to be really hitting on a lot of things that are going to be about the 2024 open enrollment period, which is just 6 weeks away. So some of the things that we are going to be covering in our October meeting will be an open enrollment refresher, which will have key dates and activities, customer notices and communications, reviewing and updating customer applications. We'll also be talking about renewals, which will be occurring in October. So how to determine why a customer was not auto-renewed or was auto-renewed without financial assistance, why some customers are renewed from a bronze plan into a silver plan, which is something new that's occurring this year, and then understanding why a customer's financial assistance and net premium has changed. We'll also be covering the unwinding, the loss of Medicaid and CHIP, and how we're going to kind of handle that through the open enrollment period. So how to help customers losing Medicaid, and then including those with the earliest possible effective date of coverage that they are entitled to. Also, we'll be touching on qualifying life events during open enrollment, so how to report life events, and then shop for desired coverage start date. So we really just encourage everybody to attend the next PCW. Again, it will be recorded and up on the website, but we really hope to see you there. And then we're just going to kind of talk a little bit about the unwinding update, which is moving along as usual, nothing too crazy. So we're still contacting customers with direct notices, with mailers, emails. We have a priority list for outbound calls, and we are also texting those who have been account transferred. So that's continuing on as usual. Everything is going great with at least the customer communications, and we're hitting people as much as we can, at least directly, as much as information as we have. We have participated in 13 press conferences in communities across PA in partnership with the Department of Human Services. Although I will say now next week that number will be 14. So we're continuing to hit across Pennsylvania the different communities as our earned media approach. As always, we have a stakeholder toolkit that is available on our stakeholder webpage, which is agency.pennie.com/toolkit. We have FAQs, explainer videos, social media posts, digital graphics there. And then also DHS has their own toolkit page that you can visit as well, which is linked in the slide. Our advertising and media campaign is still running, targeting lower income households, vulnerable populations, and non-English speaking audiences. And then our sister network and the YMCA Health Equity Tour is ongoing as well. And again, we'll be giving an update at the next PCW about how all of this unwinding fits in with open enrollment. All right, and then I'm also just now going to touch a little bit on the 2024 Assister and Broker Recertification Training. So Assister training is now live. It started live on Monday. Requests for Assister trainings can be made under the Get Certified, which is linked there at our agency page on our sister page on the agency.pennie.com. Additional information on becoming a Pennie Certified Assister can be found at this link on this slide. New assisters who recently took their 2023 new assister training must take the refresher training for 2024 to remain Pennie certified throughout 2024. Emails are being sent to all current assisters as a reminder to complete the training before the deadline. And individuals with an existing Pennie training account who need password reset assistance should send an email to pennie.training@cognosante.com. Please allow up to 2 weeks for the assister certification status to be updated. And also an important note, current assisters who do not complete their Pennie assister training by the deadline will be decertified effective December 31st. And all customers will be de-designated. So customers cannot be restored after the decertification takes place. So it's really important to take the certification training by the deadline. All right. And then a little touch on the broker training, which is also now live. So new brokers can become certified at any time of the year, certification through December 31st. And current Pennie certified brokers, though, must complete the 2024 recertification training by the deadline to continue as a Pennie certified broker throughout 2024. Once you have satisfied all requirements, your Pennie broker certification end date will update to be 12/31/2024, confirming your recertification has now been completed. Just please allow 5 to 7 business days after completing the training for Pennie to review your account, your eligibility for recertification, and your PA producer license status. Another important note here too as well, if recertification was not completed by the deadline, the broker will be decertified effective December 31st, and all customers will be de-designated. Decertified brokers cannot become Pennie certified again in the future by completing the full new broker certification training. They can become certified again in the future by completing the new broker certification training. Their previous book of business, though, cannot be restored after decertification. All right, so now I'm going to move it on, and I'm going to hand it over to Hannah to cover 2024 planned shopping enhancements.
Thanks, Kelsey. So I'm going to talk about a couple of updates to what you're going to see in planned shopping for 2024 plans, and then before heading over to Robert, who's going to talk about other enhancements that are going to be coming up in our upcoming open enrollment period. So for a couple of options, improvements related to dental plans, display, and then one other item related to medical plans. So you can go to the next slide for me. So first item is minor, but I think a really big improvement here is when you are looking at the plan benefits for standalone dental plans, you currently see what you see on the left with the detail for adult dental and then child below. The order of the plan benefits is not exact, doesn't match the same order that you are used to seeing that most carriers present their materials in. Usually the order is from the routine services at the top and then going down to major and ortho at the bottom. Current display is sort of mixed the other way around. And so we've seen some confusion from that. So starting with our 2024 plans, you're going to see on the right that we have switched the order. All the same information is being displayed, but you're going to now see it in the more traditional order, between the routine services first, then basic, then major, and then down to ortho. So if you can see, just I highlighted the routine services on the current display, have moved from the bottom up to the top. So we think that'll more streamline the shopping experience, matching a lot of the insurer's materials as well. So you will see that for the 2024 standalone dental plans. Next item is also related to dental or our standalone dental plans. Next slide. Thanks. So this is this is actually some new information that will be on the plan benefit details for our standalone dental plans, and that's the adult dental deductible. So currently that information is always shows up as not available. It's a little bit of a technical reason why that's not available in the plan display, have to do with some of the structures and online plan filing templates that they use. So currently, in order to see the adult dental deductibles, you'd have to go into the insurer's plan brochure to see that detail. But now for 2024, we've updated the template. So there's a way for the carriers to actually provide us with that adult dental deductible. And so now you will see that actually populated in the plan shopping. So previously it would have said, you see on the left, and it would say not available. Now you'll see whatever that value is. You know, in this case, it's a $50 combined in and out of network. So it's not the plan tiles at the top for the for standalone dental plans only includes the child deductible, but you will now see the adult deductible in the plan details. So those are just a couple of updates related to dental plans. Next page is an update that's actually going to be related to medical plans only. So starting with our 2024 plans, Pennie's plan shopping pages, on the plan details page, you will see the insurer's current medical loss ratio on the plan details. So if you see in the screenshot here, when you go into plan details, you see the plan highlights box at the top. You'll now see medical loss ratio in there, along with like the quality ratings that we introduced recently as well. So that will be displaying whatever their current medical loss ratios are. So for the 2024 plan year, obviously it's going to be the medical loss ratios that were available as of this summer. And for that company, that insures entities. So that usually goes back to costs from 2022. So there's a little bit of a lag for that, but that is, it'll show that information there for customers. And as I'm sure you all know, right, the medical loss ratios is one of the ACA requirements that ensures that insurers have to spend at least 80% of their premiums on medical care. So 80 cents of every dollar has to be on medical care. And if they fall short of that, then they have to issue rebates to customers to satisfy that. Okay. So with the 24 plans, this generally is going to be only your medical plans. You will start seeing the medical loss ratios for that insurer in the plan details page. And we've added some links here for those of you who want any more information on medical loss ratios and all the underlying details of how that works for the rate rules, etc. So those are just a few items for plan shopping enhancements. Next, we're going to hand it over to Robert Kofi for some updates to some system enhancements that are going to be coming soon here at the end of the month or around October 1st.
Thanks, Hannah. And for those of you who haven't talked to me before, I'm the release and delivery manager for Pennie. So I oversee the system enhancements and everything that goes on a quarterly basis with our vendor. So we'll be talking today about a few of the things that are coming up in our October release. If you want to go ahead and move to the next slide. So we've got a couple things we're going to talk about today. First of which is the ability of an agency manager to promote an existing broker to that same role as an agency manager. We'll talk a little more about what that will allow them to do. A key enhancement this time is the ability to remove an individual member from a household. And then we have some improvements to the broker and his sister portals, allowing those folks to be able to send feedback in on the system. I think that'll be important. The uploading of Word documents in tickets so that you can provide proof of satisfaction of a DMI. And also always working to minimize the amount of duplicate accounts that we have in the system. So we've got another enhancement on that. And then also notices when mail is returned to us as undeliverable. And we'll talk a little more about that. You can go ahead and move to the next slide. So currently, agency managers do not have the ability to promote an active certified broker within their agency, and that's important. They need to be active and certified from an agent to an agency manager. So if you are an agency manager and you need to promote one of your brokers to that role, you would go into your account, search for that broker that you want to promote. And on there, you'll see, as it's displayed to the right here, there'll be a button that says change role. You click on that, and then it asks you to confirm that you want to change them to an agency manager, and then you'd click on confirm. Once that's done, the folks that are in the agency admin staff will be able to see that change in the person's role. And also, just as a kind of a quick reminder, if that broker happens to be in the system at that time, they would need to log out and log back in for that updated role to show up for them. What that provides for that person is now this new agency manager can add brokers to the agency. They can view the customers for all the brokers in the agency. They can change the customer designations to different brokers within the agency. They'll also be able to edit the agency information like locations, hours, and obviously still continue to be able to manage their own designated customers. Now, what you can't do as an agency manager is remove that role and change somebody back to a broker. That has to be done by an entity administrator. So once you promote somebody to agency manager, you would need to get an entity administrator to go ahead and change them back to a broker. Okay, next slide. This is an important enhancement, and one we're going to spend a little bit of time on, a couple different slides walking through how to remove members from a household. And in this, it's important to understand whether or not you're removing a person from an application or just changing their status to not seeking coverage. And we'll walk through a couple examples of that, and hopefully this will make it clear for everyone. So when you're trying to figure out, am I just changing them to not seeking coverage, or I'm actually just taking them out of the household on the application, ask yourself a couple questions. First, is the person seeking coverage through Pennie? If the answer is no, then you'd want to remove them from the application. And is the person a member of tax household for the coverage year? Answer no, then you'd remove them from the application. Examples of this: somebody who's died in the previous year, or somebody who got divorced in the prior year, and they're not supposed to be part of the household for the next upcoming year. That person you remove from the application, and they're not considered as part of the household when eligibility is determined. Now, if you think you need to keep them on the application, they're just not seeking coverage, same thing. So let's say that somebody is a child, 22, they're part of the household, but they have other coverage someplace else, or your spouse has coverage someplace else. You want to keep them on the application because they are still part of your tax household. Or another example is somebody died within the current year, and you're going to be still claiming that person on your taxes at the end of the year. In those instances, you'd want to keep them on the application and just change their status to not seeking coverage. Obviously, this can be a little bit confusing, and if you have questions, you should consult a tax advisor to determine whether a deceased individual or a former spouse will be considered as part of the consumer's tax household, and make sure you get specific feedback from them on how you should proceed. And again, why this is important is household size and composition. affects the premium tax credits that an applicant's eligible to receive, and want to make sure that you're doing it accurately and not creating any tax liabilities at the end of the year. Next slide. So how do you go about doing this? Well, when you go in to remove somebody from the application, you'll be prompted to confirm if the member should be removed or marked as a non-applicant. So that goes back to the previous slide and the differences between the two. If the member is being removed from the application, the system will then prompt you to select a reason. And this is something we haven't had in the past. And when you're asked to select a reason, you'll have three options: death, divorce, and other. If you select death, for instance, you'll be asked for an event date, the date when this person passed away. And you'd fill in that date and then click save and continue. Next. So here's scenario one. A member of the household is deceased and will not be claimed on taxes at the end of the year. Expected outcome here is you would remove that person from the application. So you go in, you would edit the application, go to the household members page, click remove member, confirm that you're removing them from the application, select death as the reason, and enter the date of death. Scenario two, member of the household is deceased and will be claimed on taxes. In this instance, we want to keep them on the application, just mark them as not seeking coverage. So again, go in, edit your application, go to the members page, click remove member, and then select member does not need health dental coverage. Member remains on the application as not seeking coverage, and therefore remains in the household composition for the purposes of premium tax credits and eligibility. Next slide. So moving away now from the how do we remove an individual person, one of the things that we've been trying to do over the past couple of years, and I know Hannah's been a big supporter and advocate of this, is to get the feedback from our brokers and assisters on the portal that you use and how can we make it easier to use, more informative, make your jobs easier to perform. So now on the bottom right-hand corner of each of those portals, you'll see a green button there that's designed for you to click and collect your feedback. We have in the past been soliciting you for things like appearance, filtering capabilities for your books of business, easier ways for you to look at what you're doing in the system. And that's what this button is for. So instead of capturing those things informally, we'll be capturing through the system. And once you do that, you're brought up to a new tab in the system and be able to provide your feedback. We're keenly interested in trying to figure out ways to make this better for you and look forward to your feedback. What that'll do is go into a process where we look at what enhancements we schedule for each release. And if we have a large number of brokers or assisters looking for the same kind of improvement, we can put a higher priority than that and work with our vendor to schedule a release for that implementation. Really looking forward to getting your feedback and hope this is a big help for you. Next screen. Few other changes coming in October. We're going to now allow for Word documents to be uploaded in the .doc or .docx versions. And so you'll be allowed to upload Word documents for things like DMI documentation, documentation for QLEs and SEPs. When a customer creates a new ticket, and when assisters and brokers are creating new tickets for themselves. The other side of that is, and will be coming down the road, once the assisters and brokers start creating tickets on behalf of their customers, enhancement will come down the road where you'll be able to use Word documents for that as well, and uploading proof into those. That one won't be available probably until sometime next year. So that's one improvement that we're hoping will make our lives a little bit easier. And then we talked a little bit at the initial slide about trying to reduce the number of duplicate accounts. We're adding an enhancement to this release where when there's not a social security number, we'll use other things like name and date of birth to signal the CSRs that potentially we have a duplicate account in the system, and will help them to find an existing account in which to help their consumers move forward. So we believe this is going to help us cut down on those issues that we've had in the past. We feel like that's been getting better with some of the other enhancements that have gone in, and hope this continues to improve that process for us. And then lastly, there's a notice that'll appear in the system to our customer service reps when a piece of mail gets returned. So we send out a notice, it comes back undeliverable. The system will have a note in it for the CSRs that when they're on the phone with that consumer, they can, one, make sure they get a correct address, two, have the opportunity to update their communication preferences. But just getting it as returned mail will not change their communication preference. So if they've requested paper mail, or they didn't make a selection and it was automatically defaulted to paper mail, that will continue. It will not automatically be changed to text messages or email. That same preference will stay in place. So I hope these few slides have been helpful in prepping everybody for what's coming in October. And I'm going to turn this back over to Hannah.
Thanks, Robert. I'm going to actually pass this on to Eric to cover our policy proposals and updates.
Good afternoon, everybody. Excited to be here to discuss some policy proposals that we will be bringing to the board in due course, but we wanted to get feedback from our stakeholders as we normally often do, seeking feedback from you through a online form. So moving into the next slide, we are seeking feedback on a couple of proposals affecting special enrollment periods. These proposals come after the 2024 Notice of Benefit and Payment Parameters, NBPP, which outlines several SEP options that are now available to the state-based exchanges. The first one being loss of minimal essential coverage special enrollment period SEP for an earlier effective date option for certain enrollees in the exchange, and then also loss of medical assistance / child health insurance program CHIP SEP permanent 90-day SEP change. So moving into the first one, we're going to talk about the loss of MEC special enrollment period here. If we can go to the next slide. There we go. Under the 2024 NBPP, it provides states the option to offer an earlier coverage effective date for specific customers who are losing minimal essential coverage or MEC. The earlier effective date option would be specific, very specific to customers who enroll in Pennie coverage in the month prior to the month they attest to having mid-month loss of MEC. So this is for customers who are losing their coverage, say August 10th, and they try to enroll in coverage before August in July. So if that customer enrolls in July, they would be able to get that August 1st date. Under current rules, the effective date would be the following month after August 10th, after the life event occurred. The purpose would be to remove coverage gaps for those who proactively enroll in coverage. So as I said, currently if an individual enrolls in a QHP August 29th, this is August 29th, with a tested loss of MEC of September 12th, the individual would be given an October 1st qualifying health plan effective date. If adopted, the policy would provide the individual with an option to enroll in QHP with an effective date of September 1st. Note, prospective effective date would remain the default option for customers. So you would always have that prospective effective date. Customers would need to select the earlier effective date when they go in to make their application. Customers who come in with a loss of coverage on September 12th and try to enroll starting, they enroll and apply on September 10th. They're not going to be able to get coverage back to September 1st. They would still only be able to get coverage starting the end of September, the beginning of October. Going into the next slide. Loss of MEC Medicaid CHIP permanent 90-day SEP. This is another option that was given to exchanges. Currently, the SEP for loss of Medicaid and CHIP is 60 days. Under the unwinding period, it was extended to 120 days. That is going to change once the unwinding period, and we'll revert back to the 60 days. So this change in policy would allow customers an additional 30 days and would match the 90-day reconsideration period currently offered by the Pennsylvania Medical Assistance Program. So under this, the first scenario here we have is a customer has a Medicaid end date of March 31st, 2024. During the unwinding, they have a 120-day enrollment period, which begins April 1st, 2024. So they'd have that full 121 days or 120 days. Under the scenario 2, if we approve this policy, a customer has Medicaid end date of April 30th, 2024 outside of the unwinding, they would be given a 90-day enrollment period beginning May 1st. If we don't approve this and we revert back to the 60 days, customer who has a Medicaid end date of April 30th outside of unwinding, and the customer requests reconsideration and is found ineligible on day 80, the customer would no longer be able to enroll in Pennie coverage because they are now outside of that 60-day window. So this change in policy would really help those individuals who, are still under that reconsideration period through Medicaid and are seeking coverage, and would be able to still enroll because they would have that full 90 days to do so. So moving on to the next slide, we are seeking feedback. We will be sending out a link to this form. You have a QR code. If you want to click it now and get to that link and start filling out that form, you're able to do so and provide your feedback and comments. We would really welcome to hear what you have to say about this proposal, and look forward to reading as you provide those comments. Moving on to the next slide, we're going to change topics a little bit, and we are going to be talking about Medicaid CHIP customer communication. We just wanted to let you know that Pennie had identified a small group of customers who were enrolled through Pennie, but likely qualified for Medicaid and CHIP. These members will be auto-renewed into plan year 2024 coverage if they otherwise qualify. In November, Pennie will send these applications to DHS for a full Medicaid CHIP eligibility determination without impacting the plan year 2024 coverage or their eligibility for financial help. So we're going to be doing that during the auto renewal process. If the customer is eligible for Medicaid and CHIP, Pennie coverage at that time, with along with any financial help they are currently receiving, would be terminated prospectively. So going forward, on September 5th, Pennie sent an email to customers communicating this information, informing them of these actions and how this will impact them. And you can see a copy of that notice to the right here. So many of your customers might have already received this notice, but we just wanted to let you know this is what was happening, and this notice was sent to these individuals. So with that, I am now going to move into, we have some time for questions and feedback.
Yes, Hannah, do you have anything that you could share from the questions from the chat?
Sure, yeah. So we've got some questions in around the section on removing members from the application and those improvements to that this part of the system enhancement section. So I just wanted to go back and reiterate what we're trying to cover here. So the key thing is when someone is determining when you need to be removing a person from the application, or when the person is still part of the tax household but is just no longer seeking coverage. So let's say the spouse now gets access to employer-sponsored coverage through a new job. Then you would update the application to say that the spouse is no longer seeking coverage, but they are still part of the tax household, so they would remain on the application. And that's important because the tax household size is a critical part of the eligibility calculation, right? If the tax household size is different, then you're going to end up with different federal poverty level calculations, and APTC calculations would change. So if, however, someone is no longer a part of the tax household, so like divorce or death, then that's when you would need to take them off of the application, with the big asterisks that we talked about, that you do need to make sure that the customer has talked to their tax advisor to be sure when this person will no longer, the deceased person or the former spouse, when that person will no longer be part of their tax household. So the year in which that person just died, or the year in which of the divorce, that is not always clear. Sometimes they are still part of the tax household at the end of the year when they file their tax return. So that's really important to make sure the customer has talked through with their tax advisor to know, is this person still part of the tax household for this year or not? And only remove them when they are not part of the tax household for that entire year. So what you'll see in that new system enhancement is it going to prompt you when you go try to remove someone from the application to make sure that you are appropriately choosing between whether to remove them from the application or whether to just update them as not seeking coverage. Great. And then I think we did get some questions around the policy item, and I believe, Eric, you did include on here the feedback form, and I believe we'll be also posting that after the work group, so folks who want to provide feedback on those policy proposals can do so. Otherwise, no other questions to share today, so I think we might be able to wrap up early. Thank you, Kelsey.
Awesome. Thank you, Hannah. Thank you to all of our presenters, and thanks for everybody for attending and taking time today for joining us. As always, we welcome your feedback, so just let us know if you have any ideas on workgroup topics that you might want to see covered in these sessions. Also, you can provide your suggestions such as Pennie site updates or any promotional materials, request to pennie.com/request support. Here again on this slide, we also have our customer service broker and assister line number, which is available Monday through Friday, 8 a.m. to 6 p.m. And everybody, I hope you have a wonderful Friday and a pleasant weekend. Until next time, thank you.